Welcome back. I'm Doc Jen.
And I'm Dr. Dom.
And we are dropping a PT Pearl on Patellofemoral syndrome. Yeah. So traditionally speaking, if we're looking at what that means, because those are both words that are very clinical, when we're talking about the patella, that is the kneecap. So think of the kneecap when we say patella, and then when we say femoral, that is the femur bone. So that is the thigh bone, you can say.
Biggest bone in the body.
Exactly. And your kneecap actually glides in that femur bone at the very end. So that's why when we're talking about patellofemoral, it's just how that kneecap is gliding in that femur bone.
And the fact that there's pain there.
Exactly.
And the fact that there's symptoms there. So we have just described that you have pain in the area of your patella and femur.
Anything that's dealing with the front of the knee, we're usually talking about patellofemoral syndrome. So it's traditionally presented as, some people call it jumper's knee, pain when you're going up and particularly down stairs, crunching and pain, I should say, when you're squatting and lunging, feeling like...
Because I get crunching when I squat sometimes.
Right, but you don't have pain.
But no pain.
And when you're sitting at a desk for a long period of time, or sitting in general, and you feel that need to extend the leg, those are some common symptoms that we usually address when we're talking about patellofemoral syndrome.
A lot of people that I've worked with, their first recommendation they get from a doctor or orthopedist will be like, oh, go home and rest. And then you can restart your activity and gradually gauge into it once the pain goes away. Great. That's kind of like just slapping a little tape over a leaky faucet and waiting for it to then pour out again once we put too much water in the bucket.
Exactly. Like if we're just telling people to modify movement, well, what about getting to the actual goals? But I want to walk downstairs with no pain. Yeah. I want to play basketball or whatever it may be. So we have to understand deeper what's happening, and we need to actually create better thought processes even with the exercises that we do. Because I think traditionally speaking, when we think of knee pain, what do I do for my knee? Right? How do I strengthen my knee? And that's where you might see exercises like squeezing a ball and doing bridges, or squeezing a ball and doing leg extensions, and things that really might help in that moment for those little areas, but that doesn't necessarily translate into standing and walking and stairs. And so we have to just get away from this idea of, oh, knee pain, let me just do my clams. Knee pain, let me just do my ball squeezes. And we're going to take you into what we believe are the foundations, and then how to properly progress into that.
And some of the things that we found in those studies were that, okay, the groups that have patellofemoral pain tend to have a lot weaker quad muscle, right? Or this muscle on the front of the leg that helps extend our knee. A couple of the studies also said, okay, it seems like they have reduced hip activation on the outside, which is our glute med, or that muscle out there. So we have reduced glute med activation. Great. Or, okay, people who focused on an active rehabilitation program and did a lot of core strengthening and hip strengthening saw improvement. Great. So we, from these studies, start to take these little tidbits. That same study also said a lot more research is done because there's inconclusive data in which exercise is best for this. Again, because depending on the person you're looking at, we're going to have a lot of different variables that are specific to that person.
Right.
So that's, again, where Jen's talking about this foundational approach. It's never one or the other. It's this, and you specifically have some limitations here. And so that's where Jen and I kind of like to take this foundational and this core-based approach to help look all the way up and down the chain as to why, again, we're putting pressure through that knee.
There's no one size fits all. And even the studies can show that, right? There is no one perfect exercise, one perfect program. And even if we're talking about this generalized strengthening as to where we need to work, which obviously it's your knee, so your hip that's above it, your core and your quad that actually works the knee. Great. But we're missing the foundation. Like, why were those becoming weaker in the first place? Why were they not activating in the first place? And that's where Dom and I go to breath work for a lot of people in the very beginning, because when we talk about breath work, we're not just talking about the breath. I mean, obviously, yes, how you breathe, where you're breathing from, all of that. But when we actually get that diaphragm to expand and work better and become stronger, and we get that lower rib cage area to kind of expand in that 360 pattern, what we're also doing is we're kind of filling up that whole inner core area. So think of the inner core being the diaphragm at the top, the pelvic floor at the bottom, the transverse abdominis, so that one of your corset muscles, you can say, the deep inner core kind of wrapping to the back, and then the multifidi, which are just deep back muscles again. So if we think about this inner type core and I start to breathe and use my diaphragm better, I also help to even out the pressures on that pelvic floor, the transverse abdomen, the front and back of my core, and the bottom and the top, right? And when I start to do that, I have this more elastic feel to everything, that when I stretch something, what happens? It contracts and it comes back. So if I can get my diaphragm and my pelvic floor, my front and the back of the core to all expand and then be able to better contract, then I'm creating this stable base. Yeah. So then I can start to say, okay, now how do I activate around the hips? Now how do I activate down the chain? But if we don't have that stable elasticity for contraction and we're just building on the outside, we're missing a whole component. That's why it doesn't become just a stair climbing thing. It doesn't just become, how you're squatting and the biomechanics. It doesn't just become the impairments of the weaknesses that we're finding on the hips, but it becomes way more. The other thing that I really liked about one of the studies is that they looked at gait and when you improved the gait, you actually improved the decrease of symptoms in patellofemoral syndrome. And this is because, again, I talk about this all the time, but our feet are foundation. And if we're forgetting about our foundation, then we're missing a huge component of what's actually happening as we go up the chain. We walk on our feet, we stand on our feet. If we don't have strong and mobile feet that can take the different pressures, think of where it's going to lead up the chain. Yeah. And so again, why we can't just look at the hip and the quad and the core, but we also have to look at the feet. You need toe extension. If you don't have big toe extension, as you do and go into that gait pattern, if that toe doesn't extend very well, you're going to end up rotating that foot and it's going to end up coming a different way. So this is where increased pronation can come from. Bunions, that hallux valgus.
Yeah, hallux valgus.
Thank you. Classic. Sometimes because I try not to talk clinically, it kind of leaves me. But kind of like that big toe starting to shift in, right? And you're noticing a bigger bunion. Well, the body gets used to how to program that way over and over again. So this is why it's important to wear those toe spreaders or socks like Dom and I show on Instagram stories a lot. Walking over the big toe, getting that big toe extension, and then having the flexibility to be able to pronate and supinate. Just because you're in more pronation doesn't mean that you need to neglect pronation. We also still need it, and we still need supination. There's a balance that we get to appreciate a little bit more, rather than, I'm too much of this, I need to now hammer into this. It's finding the balance within that foot.
I have felt some patellofemoral symptoms when I've gone on long runs and my body hasn't been ready for it and stuff. And it's because I am limited a little bit in my ankle and foot mobility. And that's where you're supposed to have about 60 degrees of toe extension. I have about 90 or more. And especially if all the specifics, and I go crazy when I look at my own feet because my PT mind starts going wild. But that up through the chain being more supinated in my feet and more rigid, I can't feel comfortable accessing that pronation as much because my feet are just so tense and scared to let myself relax into the ground. And that's where it causes how I act through the knee and puts a little more pressure through the inside of my compartment. And again, that's just my own example as to where I get to focus a lot on what my feet are doing and understand how that's impacting my knees before I go run 3 miles again.
Mine kind of starts actually more so at my hips, where I have noticed myself, so I have like squinting patella, meaning that my knee caps go in toward each other and they kind of lift. So they don't track straight. They don't, even if my leg is just passively straight out and I just extend it out, my kneecap itself will kind of tilt. Okay, and you can feel one side more than the other. And we use tape to to fix this. We call it tracking issues. We call it a lot of things. And the reality is I do get a little bit more femoral internal rotation. As a woman, we usually have wider hips, narrow set knees. Yep. Yeah. And so, but now I said all that, right? I don't have pain. Can I notice it sometimes if I don't properly open up my hips and warm up my hips and warm up my feet and ankles? Totally. I do put a lot more pressure on my knees, and sometimes I get a little little ping of a reminder to take care of myself. But in general, I don't feel pain. And I do crazy HIIT workouts and I do crazy things. And that's why we can't just look at this malalignment and say this is key, but it does play a role into, okay, how can I start to address my hips more? Or for Dom, how can I start to address my feet more? And that's where there's differences in how it responds to different places. Check your foundation. Check your feet. How are your big toe? How are your feet moving? Check your ankles, because that directly plays a role up the chain, especially when we're talking about squats and lunges and stuff like that. Check your hips. Don't forget about mobility as well as strength. This is something I talk about all the time. If the area is above and below that should be mobile, which our hips are our access point, our ankles need to be mobile, our big toe needs to be mobile. If these points are not moving well, what's going to take on a lot of pressure? The knee. So we have to, I had a girlfriend too one time when I was like treating her very briefly, and she did, or just sitting crisscross applesauce, and she put her leg in. She said, I have trouble getting into, this hip, getting into this position. And my knee kind of hurts on this same side. It's so crazy. It's on the same side. And I said, is it though? Is it crazy? Or is it related?
Yeah. I think you get a lot of people in the clinic that are just like, left ankle, left hip, left low back on the left side more so. It's generally a chain or a pattern through our tissues and how we move that is causing these symptoms, or that is the whole underlying reason. So if you have this knee pain, try not to just blame the knee for being the culprit, and do a little bit of this investigation, and you'll be surprised if you just start finding that awareness, how much you can yourself impact those symptoms on a consistent day and not feel like you need to go in to see somebody, or you need to get something on that knee or to fix that symptom, right? We always are looking for those underlying leaky faucets that we can really fix from the source.
Yeah. And this isn't to say that don't do clams, don't do, bridges with ball. No, it's still important, but just come back to a foundation underneath that first. Okay. Address the areas above and below first. And then you can start to build strength around it. And then always work with someone that's going to progress you back into your goals. That's the main thing. All right, guys, thanks for coming back and listening to another PT Pearl. If you have more questions, drop them in the comments below. Make sure to subscribe so you don't miss out on any future ones. And I can't wait to see you next time.